Hello friends, welcome to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. In today's video, what I'm going to talk about one question that a lot of parents very frequently ask, and that is how do we train our CP child to stand? Now, this is a very tricky question to answer as a physiotherapist because it varies depending on child to child. So what I'm going to do in today's video, I'm going to share with you some of the basics behind training a child to stand independently. So if you want to understand all of these, make sure to watch this video till the end. Let's begin. Friends, cerebral palsy children face one very common challenge, and that is ability to stand independently. There are multiple reasons due to which they are not able to do that. Number one is their balance system is faulty due to the incomplete development of the entire body system. The second challenge is the weakness of the muscles. Yes, the spine muscles are usually weak. Third challenge is the spasticity itself. The muscles are also tight. So when we say that muscles are tight and rigid or spastic, that does not mean that they are strong as well. So what happens is these muscles are not able to take off the weight of the entire body in the correct manner, due to which it leads to faulty biomechanics. Number 4 is the imbalance issues. See, whenever we are doing any sort of movement, one group of muscles have to relax and the other group of muscles have to contract. But specifically in children who suffers from dystonia, both group of muscles contract at the same time, making the movement inefficient or else incomplete. So if we have to address this problem, the core thing that we need to do is we need to train the muscles to move in coordination. That should be our key goal, rather than thinking I want my child to stand independently. Instead of that, if you can think how can I teach or else give the sense of standing in the right way, then it would be a right manner. So basically, whenever we try to train a child suffering from cerebral palsy, we focus on 3 areas. Number 1, sensory inputs. Yes, it's very important for the child to at first hand experience how does normal standing feels like, because it's a child. The child has never got that experience of normal standing. So until unless you don't know how does a normal standing feels like, how will you be able to do that? And that's why a daily standing practice with support gives that ability for the child to get that sense and the feeling of standing, and gives also good amount of pressure on the joints. So that is very important, and that's why one thing that you can do as a parent is to make child stand in standing frame for 30 minutes or 1 hour every single day. When you do that, the child gets a brief amount of time to get that sense of proprioceptors, to get that sense of standing, that experience of standing at first place. Along with this, you should also focus on the second thing, and that is the muscle tone. Muscle tone is one of the biggest reasons the child is not able to do the muscular movements independently. If they are spastic, if they are floppy, if they are dystonic, any of the scenario, it would cause an hindrance. And that's why focusing on muscle tone is important. Unfortunately, we cannot correct the muscle tone 100%, but sometimes you might need to take help and you might need to take some medications like Biclofenac, or else you need to take some Botox injections if required, not in every case. You need to do regular stretching exercise, you need to do regular massages so that the muscles are not as tight as they are. Whenever that tightness would be less, it would be easy for the muscles to be calm, be relaxed, and the child would be able to do the movements or the position independently or freely at least. So that's the second thing. And the third thing that is also required to be done is strengthening also. So for us to stand strong, what we need strong back muscles. We need strong abdominal muscles, or else you can say we need a strong core muscles. So core muscle strengthening is very important. Along with that, we need to focus on the glutes or else the hip region muscles. They also need to be strong. There should be a good amount of strength in the knee, front thigh muscles, because they maintain the elongate or standing position well. And also we need good foot muscles that can align. So that's why a regular exercise program that focuses on strengthening of these muscles is equally important. So when you ask me this question that how can I train my child to stand independently, then the answer is this three-step process. Number one, focus on giving the sensory feedback to the child of how standing feels like. For this, you can make the child stand on a standing frame every single day for 30 minutes to 1 hour. Number two, do regular stretching and massages and take your medication or Botox, whatever required to maintain the muscle tone of the child. And number three, with the help of your physiotherapist, come up with an progressive exercise program, plan that out and implement it. Biggest problem with parents, what they experience is they lose motivation in middle. They give up very soon and they say they are not able to see results. Children takes time to show result. You have to give that level of time to yourself to show the results. So make sure to be patient. Don't keep long gaps between your interaction with your physiotherapist. I would highly recommend every 15 days you should talk to your physiotherapist, understand the exercise program, apply those exercises that have been given to you, and then practice and give feedback. Even though you are not getting results, but still give feedback, because small modification that your physiotherapist will tell you will enable you to get that results. That's why it is important. I hope through this video I could give you that entire framework of how to train a child to stand. It requires a little bit of education from the parents end itself so that they can implement it for the child. So make sure to stay educated. On that note, I'll end this video here and I'll see you in another video. Thank you.